we give patients a written report, Anne-Marie. When they come in, they get a written report, an oral health assessment, and that assessment outlines what they should do at home, what they could do, and even for people that want to know what to do, we can help them even over the internet.
So aside from that, I mean, that's kind of like a sort of medical diagnostic aspect of your practice, but then you've also got the general practice where you can handle anything that is going on with their teeth, anything.
Absolutely. Yeah.
So the normal everyday fillings and bridges and root canals and all that stuff you can take care of.
We do all of that. We have a laboratory in-house, and I have a team of colleagues. Our doctor team can take care of all that.
I don't think that a lot of dentists have their own lab inside the practice. So you've got a
You should
pretty
save this for on the air, by the way. I was going to say, go over some of
let's
that
come
again when
on.
we're back on the air.
All
Yeah.
right, let's
Thank you.
welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. And if you have a question for the doctor, please call us at 800-859-0957. Siobhan, what were you saying over the break that we ought to start talking about
Well, yeah,
on air?
over the break, we were talking to Dr. Thompson about a lot of the extra testing that he does with the patients and giving written reports. And I think that's amazing. There's a lot of things that we believe based on what we've read about dental health and oral health. And there's a lot that people don't know. And it's really amazing that you're doing this in your practice, really informing and educating the patients. Could you talk a little bit what we discussed over the break just to fill everyone that's listening live?
Yeah, I just think that when, patients come into the office, we like to provide them with a written report. It's, most of what we have to do to make an assessment of their oral health is quite sophisticated. And so trying to tell a patient all of that in a real brief amount of time is overwhelming. So to give them a written report as an assessment really helps them understand what the next steps are. Most of this health information that we get from our healthcare providers is forgotten within an hour, and most of it's not followed. So if you give somebody something in writing, it really helps them understand what they need to do and what conditions they have. And so it's really education heavy. What we do is very education heavy. So we've created unique ways to educate the patient so that they can make informed health decisions. Most dentists, however, it's a difficult situation, don't even give the patient the opportunity to choose health, as Anne-Marie was talking about. So we really want to do that. We want people to be informed, and we want them to be able to choose and say no with dignity or say, yes, I want to be healthier.
Dr. Thompson, can I ask you, what do you think is the reason other dentists don't do that? And, is there anything going on that the reason that they may not be wanting to educate their patients, or does it have to do with the length of visits? Like, what's the reason other dentists aren't doing this?
Yeah, probably the restorative dentistry component's more productive financially. So it's difficult to sometimes think about that. A lot of as we move even more into corporate dentistry, it's really profit driven, and so we can still do very, very well, and we can do very well by educating our hygiene teams and the people that we support, the people that work with us and what for us. These people can really. We have to lead it. They have to drive it and direct it. And so it's a really educated hygiene team that, as well as my support of the hygiene team, that gets everything rolling.
I think people need to seek you out because we talk a lot on my other radio shows about prevention, and we're always bringing up the subject of the numbers of people who are dying of heart attack have gone from 600 to 700,000 according to the CDC in the last year. And albeit that we have, all of this diagnostic testing available that's out there, um, where we've got the med tech to be able to diagnose early cardiac disease or the warning signs of it, you're even farther back in the spectrum. So you're way back at the beginning of, you can actually see this bacteria. And I know from other research that we've talked about on air in past shows that Alzheimer's now can be discovered in the oral cavity. Once it gets into the brain, you're done. That's it. Some of these diseases you find out about when you're dead. So I feel as though more importance should be given to oral health and discovering these diseases while they're still in the pathogenic stage, that you can look at them under a microscope and say, okay, this is what's going on in your oral cavity and we need to get rid of it, because you get rid of it at that point in time, you're saving lives.
Well, this is the key to having a well-educated team that knows how to assess the disease and find out if something's if something's wrong early. If I can take a person that's starting to deteriorate in their 30s and find out that they have a imbalance in the mouth, and we can help them stabilize that and correct that, and avoid exposure to these high-risk bacteria for years of their lives, we could actually delay the onset of Alzheimer's disease if it's going to happen. We can change the health of the blood vessels, and we can be contributors. We're not doing this alone. We're doing this in collaboration with other medical care providers, cardiologists, physicians. So we're part of the total care team. We're not the entire care team. So I want to make sure that that distinction is clear.
But you're the starting point, though.
Yeah, no question.
You're the person that's actually going into the mouth and taking a sample of what is living in our saliva, and I can imagine that when people find out what's going on in their mouth, they must flip out. I mean, it just must be overwhelming.
We have many patients that find out, or I have many patients that found out 10 years ago they have pathogenic bacteria, unhealthy pathogenic bacteria in the mouth. We stabilize that infection, and through their education and through their increased home care, these patients have never had exposure to those bacteria again. And it's been 10, 12 years now I've been doing this research. So it's really,
So
it's
I
really
mean,
rewarding.
I basically think everybody that's listening to your show tonight should be either calling your number or getting into a dentist that does what you do. The unfortunate thing is that hardly any dentists are doing it, but I know that you're heavily involved in the, diagnosis of early onset cardiac disease, and I believe that you're also doing a sleep apnea test.
We
Can
do
you
have,
tell us a little bit about that?
yeah, we do have a home sleep study. We know that people that have sleep disorder breathing, you might think of it as either snoring, mouth breathing, sleep apnea. These types of things cause an imbalance in the mouth and create a different ecology, and that can get harmful. And it can get harmful in a number of ways. So improper respiration and improper breathing in the night can cause big problems for the oral cavity. So we want to find out anybody that has a breathing disorder, anybody that has other kinds of imbalances in the mouth. We want to make sure we can help the patient work that out.
All right, Siobhan, do you have a caller?
Yeah, I'm going to jump in. We had a call come through. We have Anna on the line from Monroe. Anna, what's your question?
Yeah, Anna, thank you for your question. Yeah, thank you for your question. The Listerine and what your dentist is doing is during COVID times, all of us became aware that if we rinsed with some type of antimicrobial, and Listerine is an essential oil antimicrobial, that we would cut down the bacteria aerosolization. In other words, the bacteria that's floating around in the room while they're working on your teeth. So that's why they're doing a pre-procedural rinse with Listerine, and we do that in practice, but we do it after we do a gum and bone assessment in the event that we want to collect a saliva sample. We wouldn't want to change the oral ecology and then take a saliva sample. So we do use those rinses judiciously, and that's what your dentist was doing, and that's a healthy thing to do. That's appropriate.
So just let me clarify this. So when you're doing this oral swab for you to detect the microbes that are in the mouth that lead to disease, are you doing this with everyone who comes in? Is every patient going through this?
No, most of the patients that go through that are patients where we see early signs of disease, and then we want to either develop a treatment plan for them or we want to help them stabilize that disease. So we use it as a diagnostic medium to help us figure out how to treat the patient. That's what we do that for. However, Anne-Marie, it's a great question because we are getting into a time where it's going to be important for everybody to know what the bacterial balance of their mouth is because it's so significant to other systemic health issues. When I first learned about this, I was purely doing this for tooth preservation, just to make sure people didn't lose teeth like grandma or grandpa did,
Right.
but not now. Now we're doing it for general health considerations, and I actually think everybody should know what's going on inside their mouth from a bacterial yeast and virus standpoint.
Oh, good point. I think that everybody should absolutely, when you go to see your dentist, that should be the first thing they do is take this swab and find out whether you're at risk because of the pathogens in your mouth. Let's come back and talk about this some more on the other side of the break. In the meantime, you're listening to the Dr. Doug Thompson radio show, where we're talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR.
You know, Emery, we can actually get these through the mail now. We could do a saliva test for people
Oh, that's
through the
interesting.
mail. So, you know, there's a couple avenues to do that. We created a company called HomeDentalExam.com. There's ways you can get a saliva test just even through the mail, and you can get internet support either through telehealth, telemedicine, so people can find out.
But who knows about it? That's the point. How do you find out about it?
Yeah, you have to hear about it on your radio show.
Well, yeah,
And
but
we are live on Facebook now,
We
by
are
the way.
live.
So now we have the
Finally.
live listeners.
It's great.
So-
So everyone tuning in live will be able to find out more about this too.
Great.
So, hello to all of our listeners in Seoul, South Korea that don't miss any of our shows. And now we've got a new doctor on talking about a whole different aspect. But, you know, it's pretty fascinating. And I quite honestly think that everybody that comes into, whether it's your practice or any dental practice, the first thing that happens is the doctor looks into your mouth, take the swab, find out what's going on in there. Because there's so much research going on about, you know, cardiac disease, early onset diabetes, and there's like 50 or something different diseases that first of all start in the mouth. Why not kill it while you're there?
57. There's no question.
57, he's got the right number. See, I
There's-
should have been up on my research.
There's no question about it. It's very significant, and as the science is continuing to play out, it's getting more and more significant. And so I do think, and we will be running saliva tests on most new patients so they can be informed. And that's something that I wasn't doing as recently as just even a year and a half ago, but we'll be doing that going forward on most new patients.
But I also think that, you know, coming back to the sleep apnea test, I think that that is crucial information because there's a big connection between sleep apnea and subsequent cardiac disease. And so people don't know that they have it. And I think that, I mean, the general thought is that everybody should have a sleep apnea test. And here you've got an easy, most people don't go for it because they don't want to spend the night in a clinic with everybody looking at them. And then they get a CPAP machine and it's very cumbersome. And I know I did an article in MD News about sleep apnea and I thought, I wonder how many people actually follow through with this. After they get the CPAP machine, a lot of people dump it because it's too cumbersome.
Yeah, the compliance is quite low, and really the people to find out and discover if you have that problem, because there's even other airway issues other than just sleep apnea. But to find out about it, we can use a wristwatch type home sleep device, and it's a validated metric that gives us a measurable, that gives us really good information about heart rate, respiration, oxygen saturation. It can give us a lot of data, and we can help identify patients that have sleep problems. But sleep problems and imbalances in oral bacteria and imbalances in bacteria that support the bacteria that cause cavities. These are really big diseases that all dentists really need to be on top of, and that's what we're teaching. And that's what we want to be about.
Oh, that's the other thing. You're teaching other dentists, which is very important because I don't think these dentists are buying into this whole system of this pre-diagnosis when they've got the ability to do it. But your sleep apnea test to come back with us, do they take it home and bring it back?
No, they take it home.
And then get rid of it?
They take it home. It's uploaded on the internet. It's disposable. We get the reading through an app.
Mm-hmm. Interesting.
Mhm.
We're almost ready to go back, right?
Yeah, back in probably 30 seconds or so.
Great.
But
Welcome back to this special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here talking with Dr. Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here tonight explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases, from cardiac disease to Alzheimer's, that through early detection can be prevented. If you have a question for the doctor on the topic we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, coming back, you're talking about the saliva test that you take in the office, and now you're saying you're going to start up doing something patients can do by mail.
Yeah, patients can get this. We've actually included something on our website that you may mention, but we've given patients, for our WJR listeners especially, I've given patients an option to have some testing. But we can do this through the mail. We can consult with patients through the internet, and it's really become an extension of the practice that we can help people learn about that. And if they have a problem, we've also created something called the Wellness Dentistry Network. It's a network of dentists around the world, actually. We have dentists in 6 countries that understand the language and get it. And so chances are we can match people up with somebody that can help them if we can't.
So people can actually go to your wellness dentistry website. Is that where they should go to find out if they're not listening? Because obviously we've got listeners in Korea and England and all over the USA. So to get to the right dentist, to get to a dentist that does what you do.
They could find some of the dentists 3 ways. They could go to the Wellness Dentistry Network.com and look for dentists in their area. They could go to the KOIS Center, KOIS Center, find a dentist. These dentists I teach there, these dentists have been exposed to this idea. I can't say they're all doing it, but they've been exposed, they're all working the exact same way, but they've been exposed to that and they understand the language. Or they could go to my integrative oral medicine website, ioralmed.com, and on there, for WJR listeners, we've created a tab where there's some options for them to engage with us in conversation and maybe some diagnostic stuff through the mail.
So it's really important, I think, that, since we talk about prevention a lot, and there certainly is a lot of technology out there to help us pre-diagnose whether you have the possibility of getting some of these diseases. My question to you is, I think it's really difficult for all the people that are listening to the show to think about, well, my dentist doesn't do that, and they ought to maybe inquire of their dentist, or it's something that I think everybody is entitled to have. They should all have this pre-screening. I think it's really crucially important because you've invested in it, you've invested the time, and it certainly is going to prevent a lot of people from getting these catastrophic diseases.
Yeah, and we haven't treated as a practice, myself and my practice partners, we haven't treated an active periodontal disease or a gum disease infection without using salivary diagnostics in over 12 years. So it's something that we really believe strongly in. We know that we learn so much information about the other components of their health and other risk modifiers that change the disease expression through understanding what's in the saliva. It's extremely important, and it helps us treat the patients better. And we see other measurable biomarkers or things that physicians measure that come down and get better and get more stable as we're collaboratively treating the patient with the physician's help.
So what other testing are you doing in your clinic, in your dental practice? You're doing this sleep apnea test where this is remarkable because people are just taking it home. They don't need to return it. And you're able to see and diagnose whether or not they have active sleep apnea, which, as we all know, can be a precursor to cardiac disease. It's very important. It's important to do these types of tests. And I think that we've had lots of doctors on the show before that have talked about everybody should have a sleep apnea test.
There's no question that it should be part of our general health screening. Most of these tests and most of the idea that the test would be warranted comes through questionnaires. So really good questionnaires is a big lead-in to figure out who might be at risk. Look, we want to be really courteous about people's resources. I don't want to waste anybody's resources. We want to make sure that we're careful with that. So if we are encouraged by the answers on the medical and dental history, and I do a virtual exam with all new patients through the internet before they come into the office. Myself or Dr. Watkins, we do that. and we get a good feel for what that patient might need before they come into the office. And this is what some of the things we can do through this type of media and through the internet. It's really nice. But I do think that if they need that screening and we get tipped off that through predictive questionnaires, we definitely want to make sure we offer that to them.
Is there anything else in your office that you're doing that other dentists obviously aren't doing that the listeners need to know about?
Well, we can do some antioxidant screening. We can do some nutritional surveys. We can do other tests for biofilm activity. Biofilm is just a word now that we don't just mention bacteria anymore. We know that the things that cause disease are bacteria, yeast, and viruses that live in the mouth, and not only just on the teeth, but they live on the tongue, the cheeks, the tonsils. This is why it's a whole mouth infection. And even if you have a yeast infection, it's going to be in the nasal passages. It can affect the gut. So it's really discovering this has really forced us to move beyond the mouth into the rest of the body. And so we do different diagnostic testing as warranted, based on what we see and when we make that initial assessment. But pre-screening, nobody would be disserved by having a salivary diagnostics test or measuring the saliva, the bacteria, or by measuring their quality of their sleep. Those are great things, and checking for cavities. And obviously, we do that clinically, visually, and we do it through our radiographs. That's why we recommend x-rays or radiographs when people come into the office.
I think for the listeners, they really need to realize that the whole shape of dentistry, and certainly what you're doing, it's not just about fixing a tooth or filling a cavity or doing a root canal or doing cosmetic dentistry, but this is a fabulous opportunity for people to really explore what's going on that could subsequently seriously affect their future health. And not just their health, but their risk for cardiac disease. I mean, I'm still always amazed by the number of people that just drop dead. The Widowmaker's still out there. I've written many articles about it.
Sure.
People just they get diagnosed when it's too late. They can't do anything about it. They wind up in the hospital. They have a heart attack. They need a stent, or God forbid, it's the Widowmaker, and they die instantaneously. And the figures keep going up instead of going down.
Yeah,
So they really all ought to be seeing you or a practice like yours right now. And I'm going to ask you this question before we run out of time. At what age do you recommend patients should start coming in and having these oral exams for pathogens?
Well, it's funny you would ask that, but we actually encourage people to have the kids have an exam at 1. And then
Wait, what?
1 year old.
Seriously?
Yeah, children.
Get out.
Absolutely. What do we get? What do we get a chance to do then? They start to have teeth. We start to educate the mother about what to do. You know how many kids are being put to bed with a bottle or being
Wow,
being
that's
misfed?
a whole nother show.
There's a whole other.
That's
That's
a whole
that's a
nother-
whole other thing.
That's pretty amazing.
And then what we want to do is most of us have our total adult dentition by the time we're 13, 14 years old. And so, 12 years old. So we want to start doing gum and bone exams on people when they have their permanent adult teeth. And we see children all the way through that, because what's very important in the children's world is pediatric airway development, making sure that these kids are breathing properly, making sure these kids are growing properly. And that's why we have a pediatric orthodontist and orthodontists that help us make those growth assessments. It's critically important. If your child's beyond, if your child's still wetting the bed, if your child's breathing through their mouth, if they're snoring, that's not normal. Those children need to have an assessment of what's going on in the mouth. That's a whole nother topic.
What, no kidding. I'm like, I don't know what to say next, because I didn't even know this pediatric airway development was something that was even out there. And I'm sure that a lot of people that have young kids they're going, what did he just say?
No question.
So you're actually doing pediatric dentistry help and oral health. Let's come back and talk about that on the other side of the break. In the meantime, you are listening to the Dr. Thompson radio show, and we are talking about oral health and disease prevention. If you have a question, you can reach the doctor directly by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You are listening to the Dr. Thompson radio show on News Talk 760 WJR. Are we back on
Okay,
Facebook?
we're back on
Yeah,
Facebook Live
Boy,
on the
that
air
kind
at
of
Emery,
47 after.
blew me away.
yeah, we have a policy in the office. If somebody drives you to the practice, then whoever's waiting for that child in the waiting room has to fill out. There's a pediatric questionnaire, a very validated survey about children's health. And if there's more than 5 or 6 answers on that questionnaire that are yes, that child needs to be screened more. A deeper screen into airway development, growth and development. So things like thumb sucking, things like kids that have tongue ties, kids that have other oral conditions, certain oral conditions delay or postpone the proper development of the face and jaws, and that affects the airway, and that starts a whole series of issues. It's like,
Totally never heard of this. Have you, Siobhan?
No, not at all. I mean,
This is
I'm
really
totally floored by it.
I'm
Yeah.
floored by it
there's
too.
other
That
experts that can come on that I network with that understand that a lot. But we've learned a lot of dentists are learning a whole bunch about airway development, and it's critical to intercept problems in children. Snoring children, it's not normal. So if you have a child that snores, we think it's cute. It's not. It's not normal. It's the first sign there's an airway obstruction, and we need to make sure that we get that fixed. Children with crooked teeth, it's not normal. Children should have space between their teeth, so for their adult teeth to come in properly. If they're crowded, if they're not developing properly, if they couldn't nurse, there's probably some kind of issue with the structure of the mouth, and then there could be some kind of issue with the function of the mouth as well, and that needs to be assessed.
this is pretty remarkable. I didn't even know this whole thing existed. I'm thinking about, I mean, your pediatrician's not going to say anything to you about your oral health or whether you're sucking your thumbs or snoring at night. I mean, I don't remember ever seeing a pediatrician that even brought this up.
Yeah, well, the pediatricians are getting more and more on board. The ear, nose, and throat specialists are doing that as well. So they're starting to get much more aware of it, but it is relatively new.
I know, but
Newer.
people don't get to see an ear, nose, and throat, any ENT person until they've really got something wrong with them, and they're usually older.
Yeah, it's usually big tonsils or they have
Right.
repeated bouts of tonsillitis or tonsil issues. But yeah, we're screening children as well. Now we have predominantly an adult practice, but it's important for all of us that are practicing wellness dentistry to make sure that we don't let these kiddos go uncared for.
So the question is, should the listening public be asking their dentist if they practice wellness dentistry? Is that the question?
Well, there's not an official discipline called wellness dentistry, but it's just taking that whole body and that whole body health approach to children and to adults, and we're looking beyond the teeth for other things that can affect health and wellness. And the nice thing, 72% of our patients come to us regularly. About only 52% of the people go to physicians regularly. So our hygiene team, the people who are standing in front of the patients for 45 minutes to an hour, if they have a little bit of awareness about oral health issues and what things they can see and detect early, it can be remarkable how they can educate the patient and say a few things to get them either to take the next step toward better health or get the right help.
That's pretty remarkable, actually. I don't know what to say about that other than how are people going to find out about you?
Well, we're going to tell them.
I know, but I mean, it's who knew about this whole pediatric airways, and I don't think even the pediatricians think about this stuff. Well, maybe they do now, but I don't think they do. Anyway,
Yeah, we're back in less than a minute, probably 30 seconds.
Thanks.
welcome back to the last segment of this special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you've got a question for the doctor on the topic we're discussing tonight, please give us a call at 800-859-0957. Again, that number is 800-859-0957. Dr. Thompson, unfortunately, this is our last segment. Time always flies when the shows are very informative. What do you want listeners to know? Because I feel as though a lot of them are being shafted. I kind of just feel as though, you find a dentist and this is just kind of jumped over and we go directly to, x-rays and refill, filling teeth and root canals and cosmetic stuff, but there's nothing this wellness dentistry that you're a proponent of, and you're teaching dentists. You're going all over the country teaching dentists. We're
Correct.
lucky you made it here tonight.
Thank you.
And but tell the patient, tell the listeners what they need to know.
Yeah, I think we want to make sure that they have the knowledge to make good clinical decisions about their oral health, and so we need to do that proper assessment. And dentists, I think the dentist has a responsibility to look the patient in the eye and tell them that their mouth is in no way contributing in a negative fashion toward their overall health. And it takes a little bit of knowledge to do that. And it's out there. We teach that at the Koi Center. We teach it through our Wellness Dentistry Network platform. We speak that and live that in our practice. It's very important. And a dentist can learn that. And it's basically how to control these bacterial infections and these things that not only affect the teeth and cause problems for the teeth, but travel throughout the body and through the blood vessels of the body and end up causing problems downstream for, again, how many? 57 different systemic diseases.
Oh yeah,
So,
and let's face it, with Alzheimer's, there's no turning back. Once it gets into the bloodstream and into the brain, you can't get it out. There's no treatment for it. It's the end of the line. You just live with it until you die, and it's a disastrous, long, painful, horrific death, not just for the patient, but for the patient's caretakers. And so, people have to realize that there is no turning back from some of these diseases. There's no turning back once your heart gives out, or once you start going into heart failure, or God knows what. And if we know that we can get on top of prevention at a very early age by just asking your dentist, do you practice these diagnostic tests? Do you have this ability to look into what pathogens I have in my mouth that might eventually lead to one of the 57 diseases? We have the technology now. We know it's out there. We know that it's preventable. But I'm kind of concerned about the fact that everybody who's out there that's listening, that's going to a dentist, is saying, well, my dentist doesn't do that.
yeah, well, the key piece for the dentist and the general public to understand, it even goes back to 2004. Time Magazine produced a really nice article on inflammation. And so it's about inflammation, and inflammation is the killer. And what these bacteria do is your body reacts to them in a negative way, and it creates inflammation in the mouth,
Hmm.
and that inflammation goes through the system. So if any of our listening audience knows anybody who went down with a sudden heart attack or a stroke that seemed presumably healthy, we have physicians that are teaching early, and you have one of the great physicians on your show
Right.
regularly, talking about early disease prevention.
Right.
And the link is the inflammation caused by these bacteria in their component parts that cause this sudden heart attack or stroke. And so we can see that. And how can we see that? We can measure for it. And so, how simple. These tests are not expensive. They're accessible, and they're predictable, and they're reliable. So I think we would love for everybody to know their oral health inflammatory status, and our hygiene teams and our care providers that we train know how to do that. And that's a
Good
great
point.
benefit.
Oral health inflammatory status, because inflammation is what causes just about every bad thing that happens to you down the line when
Totally.
you get disease. And obviously, well, I don't know. I think we're very fortunate now that we have the capability, that we have dentists like you that are invested in prevention, early diagnosis. And unfortunately, I come back to the same thing at the end of every show. It's incumbent upon the listener. You're going to have to ask your dentist, or if you're looking for a dentist, find one that is going to do this type of screening included in your oral health.
No question about it. And we're encouraging dentists to do that. We realize that there's a learning curve to this journey, but it is a journey. This is a journey for dentists to learn about, and we have resources for that. Again, the Koi Center in Seattle, Washington, they can come and learn there. Consumers, I think, in our listening audience should ask their dentist if they're studying this area, and if they know about it. And if they don't know about it, then there's internet resources where they can get help, and they can learn this. Everybody should know. Everybody should know, and everybody should have the right to either accept or refuse treatment with dignity. And our job is to make sure we provide the expertise, the skilled care and judgment to help them be healthier.
See, I think everybody should take advantage of this type of screening, and I think it should be, if you're, I mean, what about somebody starting at like age 20? Never mind about the pediatric that you talked about before, but is it too soon to start this type of screening at age 20 or 30?
Absolutely not. The children it's recommended that children get their cholesterol checked now between 7 and 9 years old.
That's
I
pretty
mean,
amazing.
who'd have thought about
Wow.
that? So no, it's not too early. We see many diseases manifesting earlier. It has to do with our lifestyle, our diets, how we live, and so there's no question that it's not too early, and it's not too early, sure, to educate people about what to look for. So that's the other thing. We start to educate our patient population about what to look for, what's healthy and what's not healthy. And so they realize if they come in a future subsequent appointment and they are showing signs of disease or not being healthy, we're gonna help educate them.
And these tests are not really invasive. It's not like it's not that they are having to be injected with anything,
No.
or they're not invasive. They're pretty simple, straightforward tests, and I'm imagining the cost is not too expensive to have the test done.
Very simple, straightforward tests, and these tests are typically most of these tests are under a couple $100. They're not covered by medical insurance. Many aren't covered by dental insurance. This is one of the issues, but it's such a critical test for your overall health that if you have, if you can set aside a dinner out, you can have a test done.
No, well said. And we talk about this a lot on the other shows on prevention, that the tests for cardiac disease are not covered by insurance. But on the other hand, they're like 125, 250, $200 or $300, like you said, forego a night out on the town and get the test because it's going to save lives.
Totally save lives.
And I think that's crucially important. We've just got 40 seconds left. Dr. Thompson, do you have anything else to say? We'll definitely have you back on the show, so you're not leaving.
Thank you. I just think that detecting disease early is so important because it's super easy to treat. That's the key. And detecting disease late is very easy, but treating it's almost impossible. So we want to do early disease detection because then we can really help patients in an easy way get well and be well. That's the idea.
Yeah, so make sure that your dentist offers these tests, and if not, then make sure you get in touch with Dr. Thompson, who can put you in touch with the right dentist.
We'd love to help you.
Absolutely. Well, unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on News Talk 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin. And again, I want to thank Dr. Thompson for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope you enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Thank you for listening. Good night and be well.
All right.
Good job. See, you did a good job. Isn't it amazing how the time flies by, though?
Goes quick. Yeah, it does.
And I mean, you only got one call, but I mean, that doesn't mean anything because Colin, 2 years later, sometimes you'll have one call or two. You never know. I think people